Good afternoon, doctor. I just read an article about how we need to become unconventional in our approach to educating our dental patients. And boy, did that set me to thinking. I thought, what approaches might be viable? Certainly our conventional ones are not working. When we say brush and floss to patients, how many of them do, right? How many of my patients wear their elastics, etc., etc.? I was fortunate to grow up with a mother, I was thinking, who taught us health practices, who taught us about good nutrition, who taught us about exercise and movement, who wanted us to know that we were in charge of our health, not somebody else. She was constantly working with us and making sure that we knew what health habits were all about, such as eating healthfully, even. Then I went to nursing school before dental school, and I discovered that all of these sick, hospitalized patients who had diabetes spiraling out of control, who had high blood pressure and cardiovascular diseases that were worsening and not improving, who were repeat patients over and over on the medical units of the hospital there, were basically having none of what I was telling them. They were kind, they were gracious, they were nice to me, but as a nurse, even though I was to educate them and I would go in and spend time with them, they were having none of it. Nothing was changing. They were hoping for the pill, the insulin, the surgery, the treatment, something to fix them. But they didn't seem to be able to understand it was within them. And that made me realize how difficult educating people about their own health could be. So, pretty much at that point, I realized that it spanned every socioeconomic level. It spanned every educational level. It basically was the human being and the way we are. How many people do you know that have a belief that activity and exercise make them healthy? That have a belief that good nutrition is going to help them be healthier? How many people do you know that actually feel that what you're telling them is going to help their overall health? We certainly have all the literature out there to say that periodontal disease and cardiovascular diseases, as well as diabetes and many chronic diseases, are interrelated. Do they care? Of course they care. They don't want to be sick, but do they care about what you're telling them? Do they care to take on what you're saying and see if they can change their lives? Do they want to hear it? As a dentist treating children, I can imagine that it would be shocking to have someone call my office and say, my child has a toothache and he's had decay before, and I know you all have told me that there are things that I should be doing differently. I want to come in and learn them. I'm really going to do it now. Enough of this. I'm not going to let this happen anymore. Wouldn't that be amazing? Wouldn't that be amazing? Of course, in our heart of hearts, we want patients to be educated. We see it as our role. We care most of the time way too much because we can't accomplish what we set out to accomplish, and that's hard for us. But you know what? Most of these people are not maintaining health practices based on the education they're getting from their physicians, from you, or from anyone else. They just aren't doing it. So despite wanting to help, despite wanting to educate, think about it. We have a degree in dentistry, not in education, and thus we are being paid for the technical aspect of our clinical care. And while we take on, because we feel it's the higher road, we take on the education, do they really want that? Is that a viable role for us? Paying patients may be more willing, or are more willing to listen, to hear what you have to say, because they're already demonstrating that they are taking some responsibility for their life. Patients who rely on Medicaid and other insurance often don't even get to the point of realization that they can be responsible. So you might have a little bit of a better chance with the patients whose parents are paying and willing to do so and value it. But even so, the reality is that there is a place for a certain amount of education, and we would feel remiss if we didn't try. but we must use it discerningly. Perhaps that is the new unconventional way to communicate, you know what? Not so much the point of the education as our caring. Because when they think you care about them, which you certainly do, then they're more likely to respond and actually take on some of what you're saying. And you know what? The occasional parent who will take it to heart is certainly the exception, but that is one life and her children's lives that you can possibly change. So think about it. Those are good questions for you today. How can we make education more viable? And what can we do and should we do in our delivery of educational aspects of dental care? Dr. Chris, signing off.